Welcome to the To Your Health Podcast, your go-to source for everything health, wellness, fitness, and the latest in medical insights. I'm your host, Rhonda Alfred. Joining us today is Dr. Alana Nichols, a pediatrician and internal medicine physician at Terrebonne General Health System. Welcome to the show, Dr. Nichols.
Thank you for having me.
Well, thanks so much for being here. I know you've been really busy lately.
Yes, ma'am.
Getting in the
Absolutely.
groove. Well, can you tell us a little bit more about yourself and your role at Terrebonne General?
Yes, so I am an internal medicine and pediatrics physician. We call it MedPeds for short. But essentially, that means I take care of adults with all issues, all chronic issues and acute issues. And then I see pediatric patients in the Terrebonne Pediatric Clinic from newborn, well child checks to acute visits as well. So I'm taking care of people from birth all the way to elderly ages and spending time within a week back and forth between the two clinics.
So you're taking care of patients for life,
Yes,
right? From
absolutely.
birth to old age.
Absolutely.
Great. We're going to talk about a very interesting subject today, vaping and the importance of it to youth and how it affects you. So let's get started with our subject.
Yes, ma'am.
All right. Well, why is vaping becoming a more of a problem these days?
I think that is an interesting question. I think it's multifaceted, really. Things come and go. We have fads that come along. I think with cigarettes, with vaping in particular, it's kind of a new spin on something that's been around forever, right? There is still nicotine that is within these electronic devices. So we have a product that is known, that has been established to be an addictive product, but then the way that it's packaged has just become a little bit more enticing. It's an electronic device, and it kind of came along when we started to see an increase in electronics and changes to electronics, and with the internet becoming on the scene and social media. There's just a new cool gadget that was out. It's almost like a new gadget. And then with vaping, there's this added layer of you still able to have that nicotine, so that addictive chemical that is marketed with different types of things that are appealing to all ranges, but specifically to younger populations with the different flavors and the different fruits. So I think that the reason that it has become more popular is that smoking is already something that a large percentage of the population partake in, but vaping seems to have been glamorized as something that will give you the same effect, but just in a cooler, more sleek way of doing. And I think the misconception is that it may not be as dangerous as the old way of doing things.
Right. That was going to be leading into my next question. Misconception is it's safer than smoking. And how do you explain that to patients?
I think that I have to be realistic with patients and tell them, yes, there is a difference between smoking a cigarette and using a vaping or electronic device. There's definitely a difference. But when we think about the dangers behind the carcinogens that are inside of cigarettes, we just have it packaged in a different way, right? There's still nicotine that is being delivered to patients. And in fact, the people who are using the vaping devices, I found, are actually using more nicotine sometimes because it's easier to just sit around and use the vaping device versus smoking cigarettes. It can be done in a concealed way, so you can actually lose track of how much nicotine you're actually taking in with a vaping device versus with a cigarette. And you don't always know what's being packaged in the electronic devices. So while we may not have the exact same byproducts that you find in cigarettes, there are different things that are being used, and sometimes we don't know what it is. And not knowing can be just as dangerous as knowing what actually is packaged, like what you have in the cigarettes.
How many puffs or whatever can you get off of a vape?
Well, it depends on the cartridge, right? And I don't know that we can equate it to, we can't equate puff to puff, like how much you are pulling off of it. A vaping device versus a cigarette. It's the actual amount of nicotine that is in the different cartridges that you have. But there's a ton in there.
Yeah.
You can get a lot of nicotine in a electronic device, far more than you can in a cigarette. And then when you think about the ease of using it, right? Typically, especially when we had changes of laws where you couldn't smoke in public areas and in restaurants and around in the shopping centers, you're able to conceal a vape, right? So you have
Right.
access to it a lot more than you have access to being able to go and smoke a cigarette. And so I think it's the combination of that that allows you to get a lot more nicotine in with the electronic device than with the cigarettes.
Yes, they
Yeah.
can sneak it. You just see them kind of going down and
Absolutely.
oh my goodness. So can vaping affect a child's lung development?
I think that, again, that is a good question. And the answer is yes, because ultimately we are still putting, when we're vaping, we're still putting chemicals that are
Mhm.
foreign chemicals into our lungs that are not meant to be there. We are not just the nicotine, but the things that are used to make it a different type of delivery to the lungs is something that's not supposed to be there,
Mhm.
and specifically for our kids that have underlying lung diseases like
Mhm.
asthma. I mean, there are plenty of children that have asthma that will eventually grow out of it. You have a lot of people say, well, I had childhood asthma. Their
Mhm.
lungs are still developing, so they are more sensitive to things that are being put in there. So naturally, yes, you will have damage that can come from vaping, just like you can from cigarettes.
Yeah, and allergies, I'm sure it can worsen allergies as well.
Absolutely.
Being a pediatrician and an internal medicine physician, how is your approach to explaining this to your different patient base change with each group?
I actually learned about vaping from one of my pediatric patients while I was in training. So it was my first time like really understanding exactly what it was. And so in learning about it, I was like, huh, I took that and started asking my adult patients about it, but it really is two completely different conversations, right? With the adult patients, it's typically my smokers who had been smoking cigarettes, and so they come in really excited that they've cut back on smoking by switching to vaping or electronic cigarettes. And I
Mhm.
have to say, congratulations, but I still don't want you to do that either, right? I have to explain that we're still getting the same nicotine, that we're still getting the same substances, just in a different package. And so it is a little bit of different conversation. With
Mhm.
my adolescents, the way that I approach it is during my well child visits. Starting with my preteens, I have, a script that I go through where we're talking about all things from having crushes on people in school, talking about sex, drugs, and alcohol and tobacco. And I've learned from kids that I have to be very specific and
Mhm.
very detailed in what I'm asking them, because if I don't specifically ask, uh, they will say no, right? For
Mhm.
instance, I'll say, I used to ask, do you smoke? And the answer was no, until someone said, well, you didn't ask me about vaping. You asked me specifically about smoking. So
Mhm.
my list gets longer and longer, the longer that I am out in practice and the longer that I'm away from training. But I try to be all inclusive. And a big part of that with kids is making sure that you have the trust and that you build a relationship. And so the way that I do that with my well child visits, again, starting with preteen, is that, with parents are in the room, I ask if there are any concerns that parents have specifically. That's when I do my exam, because kids are more comfortable usually when parents are there. And then I ask the parents to leave. I let them know from the beginning that for all of these visits moving forward, I have a session with you, but then I also have an opportunity with children to be able to talk to me, because they are getting older and it's important for them to have relationships with their
Yeah.
physicians. And then once the parents or the caregivers are out of the room, is when we have those other conversations that kids aren't necessarily wanting to talk about in front of their parents. And it's there when I ask them details about, what types of activities they're in, and try to get them to open up. And usually they are a lot more comfortable talking about it during those sessions when they're away from parents.
Right. Developing that relationship's what it's all about, right?
Absolutely.
Do we know any long-term effects that vaping can have?
You have some great questions there. Yes, absolutely.
It's all new.
There was a thing, lung injury that comes from vaping, and I actually saw it a couple of times in training, where I had teenagers that came in that had extensive history with vaping, that had long-term lung damage from it. So absolutely, you can definitely see those types of changes. This became a thing that was being researched a lot right on the brink of COVID. And so I think some of it may have lost its steam because, COVID came along and caused a completely different type of lung damage, and became the forefront of a lot of the research that went into it. And so hopefully we'll get back to focusing some of that research on some of the long-term effects from the electronic smoking.
Right. And this is another one, secondhand vape smoke. I mean, is that harmful to, family members and other people around?
There is a misconception that because you can't see the smoke the same way with electronic
Hmm.
cigarettes as cigarettes, that you don't have the secondhand smoking effect. But there have actually been studies done that have kind of refuted that. There was a study done, I think, about 10 years ago, if I remember correctly, where the simulation of vaping was done in a room with some volunteers that had a history of smoking. And the amount of nicotine that was in the air was calculated with vaping versus with cigarette smoking. And while there is less nicotine in the air, there definitely was enough that was in there that could contribute to secondhand effects that you see from smoking.
Getting back to like helping parents to know if their child might be vaping, what are some signs to look for that they can maybe identify with their children's
You know,
behavior?
I think that that's a good question, and it's twofold, really. Nicotine is addictive. It is a drug, and so I think in that regard, noticing your child's behavior changing in general is a sign that is there something else that's going on, right?
Mhm.
I don't think that looking for signs of vaping would be different than looking for signs of any other drug use or alcohol use or cigarette smoking or illegal illicit drug usage. I think it's very similar because we're still dealing with a very addictive product.
Mhm.
And so I don't think that we approach it differently. I think the bigger thing that's important for me to talk to parents about is that our kids today have the same issues with peer pressure that they had when we were growing up. But then on top of that, access is completely different now. With social media, the way things are marketed to kids, they are fighting an uphill battle that might be arguably different than when we were growing up. And so I
Mhm.
think that we have to give kids grace, but we also have to give parents grace in that we are fighting against something like information that is basically a fire hose to kids, that is just constantly being inundated and put on their minds, right? As long as they have access to the internet, they're going to have access to learning about things that we don't necessarily have. And so just trying to have that open and honest conversation with kids.
All right. Well, thanks for that advice. We appreciate all the information you shared, and I'm sure it's going to help somebody out there today.
Absolutely. Thank you
Thank
for
you.
having me.
For more information on vaping and Dr. Alana Nichols, visit tghealthsystem.com. Thanks so much for joining us, and don't forget to subscribe to our podcast where you get podcasts.